A disastrous lapse in Medicaid funding for Puerto Rico has been averted by last minute consensus in Congress, and funding levels for the USVI and other territories has been permanently boosted by the deal. Details of the yet to be published agreement are still scarce, but Senate Majority Leader Charles E. Schumer confirmed to the Washington Post that Puerto Rico's Medicaid program will be funded for the next 5 years. Apart from avoiding a devastating fall off the funding cliff, which could have resulted in benefit cuts and a lower level of payments to hospitals, Schumer told the Post in his statement that, quote, the record levels of funding provided in the bill will allow us to expand access to care for our fellow American citizens on the island and ensure long-term stability for Puerto Rico's hospitals, providers, and healthcare system. Other U.S. territories, including the USVI, will now receive federal matching dollars for Medicaid at the rate of 83% permanently. The rate had been increased from the statutory rate of 55% through fiscal year 2021, and without this deal, local hospitals were set to revert to the lower reimbursement rate at the end of this week. Low reimbursement rates for Medicare and Medicaid have been a drag on the finances of local health institutions. In September, CEO of Schneider Regional Medical Center, Tina Commission, said that in 2021, the facility billed $37.4 million for services to Medicare and Medicaid patients, but received less than $12.6 million in reimbursement. The extra federal spending dollars does come at a cost, however. Last September, the Biden administration interpreted recent laws to conclude that Puerto Rico must receive a minimum of $2.9 billion annually for its Medicaid program. At the time, head of Puerto Rico's Health Insurance Administration, Jorge Galva, called it an unexpected but welcome addition. That elevated level is now expected to end after 5 years without congressional renewal, freeing up federal dollars to pay for the package that has just been agreed. The adjustment comes as part of a major spending bill that will fund the government until next September. The package includes legislative compromises from both sides of the aisle. Democrats included a permanent extension of Medicaid postpartum benefits for 12 months and a measure to prevent children from being disenrolled from Medicaid or the Children's Health Insurance Program for 12 months, notwithstanding family income fluctuations. A measure to help the nation better prepare for the next pandemic also made the cut. For Republicans, language to allow states to begin re-evaluating who is still eligible for Medicaid was a key priority. Under the agreement, people could begin to be kicked off the program from April next year. The Senate is expected to vote on the $1.7 trillion bill this week before sending it to the House for approval. Government funding is expected to expire on December 23rd, making the spending bill a must-pass this week.